Vibrant Living is brought to you by Springwater Insurance Group, teaching you how to buy the best Medicare and supplemental plans for your needs, and Aging and Adult Care of Central Washington, enhancing a person's ability to maintain a life of independence and choice, and Link Transit. Take that first step. Learn how to ride.
Hello, I'm Dave Tosch, Executive Director, Wenatchee Valley Senior Activity Center. Today, I'm with Shawna Pringle. She is the Assistant Regional Long-Term Care Ombuds with Aging and Adult Care. And Shawna, I'd just like you to just in brief tell us what you do, and then maybe we can ask some questions.
Great, thank you, Dave.
Yeah.
Yes, so as a long-term care ombuds, we run into a lot of different situations, and just to give a brief overview, long-term care ombuds are resident rights advocates for folks living in nursing homes, assisted living, and adult family homes. And we get calls from residents and family members and neighbors with concerns or issues that we field and listen to and act on. Now, I just would like to say that as an ombuds, I am a low-level problem solver. So what that means is we're going to be talking today a little bit about abuse of vulnerable adults. And that's a topic that touches a lot of people. And I would like to say that a little disclaimer, I am not an Adult Protective Services employee. I am a long-term care ombuds. So the information I'm sharing today is just general information and is meant to be taken that way. So Dave, I think you had a couple questions for me?
Yeah, so tell us a little more about what is abuse.
Okay.
Specifically.
Yeah, so abuse is typically intentional harm or neglect of a vulnerable adult. And it can happen to anyone. It doesn't matter, your gender or your financial background or even your socio or economic status. Abuse happens to everyone. It can happen to everyone. So.
And some examples that you've witnessed.
Okay. Yeah. So some of the examples we see is, for example, there's the emotional abuse. Name calling or bullying can be considered abuse. There's the physical abuse, and that could be anything from, pinching, pulling, inflicting harm, and that even runs to neglect. Like if, for instance, someone is needing hygiene, needing to be bathed or that sort of thing, and they're being neglected, not cared for. That's an example of abuse. Another form of abuse is the use of psychotropic drugs. So a lot of people don't think about this, but what happens sometimes is these will be used to sedate someone so that they're not as active. That can be a form of abuse. And the last one that a lot of people think about is the financial exploitation. And there are so many parts to financial exploitation. And it can, I guess I should say too, that the perpetrators can be anyone. It can be a loved one, it can be a neighbor, it can be even a stranger who's just calling. In facilities, it can be staff members. It can even be other residents.
And so who's considered to be a vulnerable adult?
Okay. Yeah, so in my role as an ombuds, we're talking about people, let's just define that for a minute. So in my world, long-term care settings like nursing homes, assisted living facilities, and adult family homes, if you're residing in one of those places, you are a vulnerable adult, just by nature of being there. But I'm just going to read off the pamphlet, quite frankly. If you're out in the community, and at the end, I'm going to share with you some phone numbers, because there is a distinction. If you're living out in the community independently, there's a 1-800 number to call, and if you're living in a facility, there's a different number to call, but I'm going to circle back. So if you're 60 years or older, have functional, mental, or physical inability to care for yourself, or adults considered vulnerable 18 years and older who have a legal guardian, a developmental disability, like I said, admitted to any facility, or even receive in-home care services through a licensed home health hospice care agency, receive services from an individual provider, for instance, a caregiver that comes into your home, or if you have a personal aide who performs care under your direction. These are all pieces of who would be considered a vulnerable adult. So, do you mind if I talk about a few warning signs?
Please.
Okay. So as far as warning signs go, we'll talk about the emotional impact. A lot of times people who are emotionally abused tend to withdraw, they have depression, they tend to isolate more, and then talking about financial, you're going to see some large amounts of money are suddenly gone missing. Maybe they're saying things like, I have no money, and when they're asked why, it's because they've been gifting it away, or they start talking about maybe somebody in their life who, is coming to them for loans that are never paid back, that sort of thing. As far as physical abuse, it can be subtle. A lot of folks maybe could be on blood thinners, and so there's bruising that goes on. But the ones to look for are the bruising that doesn't make sense, like the facial bruising, bruising around the neck or the back, places that, we're not talking about you're bumping against the table and you got a bruise on your arm. We're talking about bruises in suspicious places, like, the buttocks or other areas like that. We're happy to take calls. If you want to reach the Long-Term Care Ombudsman Program, our regional office is here at Aging and Adult Care of Central Washington in East Wenatchee. And my phone number is 509-886-0700. Just ask for the Long-Term Care Ombudsman. Again, I'm not APS, but I certainly can listen and refer you to the correct phone number. Okay?
Well, Shawna, I want to thank you so much for being with us today. We're outside their new facility here in East Wenatchee. Aging and Adult Care is occupying the same building with, I think, the state parks folks, and it's really nice out here today. I don't know, probably getting close to 50 in early December. It's been great. And of course, then the garbage truck had to show up. Hopefully everybody was able to hear Shawna okay. And again, thank you so much for doing this for us. And I think this is really worthwhile information for folks in our community. Thank you.
Absolutely. It's my pleasure. Thank you, Dave.
Hi, I'm Ken Sterner, and I'm the Director of Kinship Programs here with Aging and Adult Care. In Washington State right now, there are over 43,000 family caregiver kinship families. These are families where grandma and grandpa mostly, but certainly aunts and uncles, cousins, even older siblings are taking care of the children of other relatives. This process allows them to keep their same cultural heritage, cultural issues and experience within a family format that the children are familiar with. In that regard, we are able to provide some assistance in navigating a system that isn't always easy for grandmas and grandpas especially. That is something we can do, and as navigators, we try to also provide, when possible, food, clothing, and a number of basic needs that people often run into. We just need you to call.
Hello, my name is Darrell Dickeson. I'm a board member of the Wenatchee Valley Senior Activity Center, and welcome to another version of Vibrant Living. Today we have the privilege of having with us Kaitlyn Quirk, and I'm reading her title here, Health Education Network Program Coordinator for Action Health Partners. And the reason I had to read that is because I know Kaitlyn from a variety of places and programs and stuff. You're a pretty active person. You get very involved. So today we're going to talk about a couple of things, but primarily the Action Health Partners organization is sponsoring I think it's called Virtual Living with virtual living well with chronic disease. And so tell us a little bit about what that program is about and when does it happen and what else we need to know.
Awesome. Yeah, thank you for having me, first of all. So our Health Education Network coordinator is kind of a mouthful, that's for sure. But basically, we provide these community-based education programs like this one happening in January. It's a Stanford evidence-based program called the Chronic Disease Self-Management Education Programs, and we just call it our Living Well with Chronic Disease. So these workshops are peer-led by certified trained peers, and by certified trained peers, and it's going to be hosted virtually through Zoom. So you'll join our 2 certified volunteers, and for a 6-week workshop where you meet once a week for about 2.5 hours. And this program, like I said, was evaluated and created by Stanford University, but it's now its own entity, the Self-Management Resource Center. So throughout the workshop, participants are going to learn practical skills for healthy living and managing chronic conditions. So it's open to anyone with ongoing conditions such as arthritis, hypertension, heart disease, diabetes, chronic pain, and it's also open to caregivers and family members of those with chronic conditions. So participants are going to practice techniques and learn how to reduce their stress, their frustration, learn how to manage symptoms, learn how to better relax and handle those emotions that come with chronic conditions, as well as learning how to eat well, safely exercise, and improve communication with your health professionals and your family.
So Kaitlyn, how big of a problem or issue is it? Chronic disease or chronic illness or pain or whatever it is that a big issue that we're faced with, or?
Well, I think what we know is that anything that's chronic has a significant impact on your life, right? You have to learn how to manage those things, and some days can be better, some days can be worse. And I think these workshops really emphasize the need for peer support, medical support, and just tools to use to manage these symptoms that you may have with any chronic condition you may have.
And what is the cost for attending this workshop?
So it's completely free. We offer all of our health education programs for free to the community. And especially now since it's through Zoom, it's going to be free. We're going to mail those materials that you need to your house free of cost. And so it's going to be completely free.
Okay.
Yeah.
How are you funded then?
So we're generally funded through Department of Health state grants, and we used to be funded through Aging and Adult Care of Washington. So there's a variety of funding opportunities that we have through the state. And then we also have our Pay It Forward donation program. So if you go to the class and you just really enjoyed it, you can pay it forward however much you see fit to make sure that we can still be providing this to the community for free.
Okay. So you mentioned Aging and Adult Care of Central Washington, and that's actually where I met you, I believe, initially. Yeah. And at one time, weren't you sort of, maybe you still are partners, or how do you work together, or are they 2 separate things?
So we're always partners with this. We make sure that we're working closely on letting Aging and Adult Care know when we have these opportunities open. And then we partner with them on other projects through the organization. We were funded through them at one point so that we had a contract, but that contract ended, and so we're funded through other Department of Health grants now.
All right, great. So how do people register or sign up for this workshop?
So the best way to register is through email or giving me a phone call. So I don't know if you want me to provide that now.
Yeah, why don't you provide that, and we'll also put it up on the screen for people to see.
Yeah, so Kaitlyn Quirk at cc-ahp, so Kaitlyn.Quirk, quirk@cc-ahp.com, or you can give me a call at 509-630-5592.
Great.
Yeah.
Thank you. You mentioned earlier about some of the chronic diseases. It sounded to me like most of them that you just happened to mention probably are experienced more by an older population rather than younger. Is that your experience with people that participate in this program?
Yeah, so we see people from a variety of ages. We know that chronic conditions do often start at younger ages, but the majority of our participants are over the age of, let's say, 50 to 80 plus. And so I'd say the majority of the group we serve are older adults.
Hi, I'm Jim Heinlein, agent here at Springwater Insurance Group, and I want to talk a little bit about Part D drug plans. Now, did you know that you actually do not have to have a drug plan? You can actually pass up on that and don't even take it. But there's going to be a little problem. See, later on in life, when you decide to join a drug plan, Medicare is going to penalize you for the time you weren't on the plan. They call it a late enrollment penalty. It's 1% per month for every month you didn't have an Advantage plan. So if you decided to join a plan after 5 years of not having this plan, this Part D drug plan, that's 5 years is 60 months. 60 months times the average drug plan for the year you join. Well, let's just say that's $50. Well, that penalty is with you every month for the rest of your life. And that's just not a good thing to do. So give us a call at Springwater Insurance Group. We'll help you understand what is the right plan for the person who says, I don't even take any medications. Why do I have to join a drug plan? All the way, we'll even talk to the person who takes 20 drugs. Whatever your case is, at Springwater Insurance Group, we're happy to teach you.
Hello, Dave Tosch, Executive Director, Wenatchee Valley Senior Activity Center, and today I'm with Jim Tarbert. Jim and I have known one another, I think, since probably close to the day I walked in here 7 years ago. Jim has been the long-term leader of our writers group, which is a very interesting group, and I'm sure Jim will talk about that a bit. Tell us a little bit more about the writers group, your involvement, and what you see from your perspective is how is it rewarding to those folks that participate in that group?
I think everybody in the group has their own agenda in terms of what they want to accomplish. The group started 22 years ago. I didn't become involved, though, until about 2012, I believe. And I had my own agenda. I had spent several years studying my family history and genealogy, and I wanted to publish it, but I had no idea how to do that. Plus, I didn't feel my grammar skills were all that good, and I needed some help. And I heard about this group, stumbled onto them, and was immediately welcomed, found it to be a valuable group, and got involved with them. Mm-hmm. And it's been a great experience.
I know that I have came in contact with a whole lot of your members over the years, and I know that you're involved in a couple other things here at the center. In fact, every year that we've had our craft fair, I think you've had a booth there, and you have some books that have been published, and talk about that a little bit.
Well, our writer group itself also occasionally puts their short stories together in a book, which we sell at the craft store. And after they taught me how to publish a book, and my skills evolved some, I continued writing, and I've written several books that sell on Amazon.com, and I do sell some of them at the crafts fair every year.
Uh-huh. And of course, we're not going to have one of those this year.
Well, yes, I'm kind of disappointed about that. In fact, I had a book all ready to go, so a new one of short stories.
You want to talk a little more about that book?
Well, I could. I wrote a book called Lake Chelan Revisited in 2014. That was short stories that recounted my experiences growing up on Lake Chelan at Manson as a youngster in the 40s and 50s, and the stories were based on my memories of the orchards, the migrant camps, the people I met, and experiences. This time I wrote a story called Apple Capital Adventures about Wenatchee and north central Washington. And I wrote 38 short stories. I wrote them in the last year and a half to 2 years, actually, to read at the writers group meetings, except we got shut down and haven't been able to have our meetings regularly. But I went ahead and published them as kind of a proof copy, and I gave each of our members a copy so that they could see what I've been doing and to kind of encourage them to keep writing and sharing their stories. And
Well, you handed me one of your books.
Yes.
Just the other day, the recent one, and I opened it up, and the first page I came to, I saw the name Lee Bofto. I knew who Lee Bofto was.
Yes. Oh, yeah.
But I thought it was interesting that you're writing with some of the local names, mentioned that people would remember. And so I didn't have a chance to read that whole article, but I'm going to go on vacation here in another few days, and I'm going to take the book with me.
For anybody who reads the book, and I'll have them at the Cross Fair next fall, will recognize stores in town and people and stuff. And the stories are all fictional, of course. Yeah. But you'll recognize things in it. Yeah. They're used fictionally.
Well, I grew up in the Valley, and my grandmother used to bring me down to the stores on Wenatchee Avenue, on a Saturday, and we'd spend several hours, and I was her company. Yeah. And I remember going to get the Thrifty. It was a Thrifty Drug that was on the corner. I think it was Thrifty Drug. It was one of those, and they had a little cafe in the back, and I remember a lot of those.
Well, back when in the 40s, when I was a kid, the hillside at Birch Mountain, which is all houses now, was an orchard. And of course, that's steep ground there. Yeah. My dad was the foreman on the orchard. There was only one house there. We lived in it. He was hired because he'd grown up on a wheat ranch using workhorses. This is the war years, no gas for tractors. And so he was able to farm that using horses. And then I went to school here in the first grade, and my dad bought an orchard in Manson and moved up there. And, great place for a kid back in the 40s and early 50s, growing up on Lake Chelan, and lots of activities there, great Boy Scout, Cub Scout programs. I don't remember much about the schools because I wasn't that good a student, but I was there. And then at some point, we moved to Okanagan, where I went to high school. And then things kind of turned around and changed for me there. Once I got interested in sports, I discovered you had to be your teachers had to sign an eligibility card. And then I got a little bit more serious about school. Started staying awake for the whole hour